Hello, welcome to America at its Best. My name is Rebecca Painter, and I'm your host for today's show. So glad that you guys are back for a third show. So I'm coming to you from South Carolina, in case this is your first time joining us. Some of you may have seen in the news that our governor is starting to reopen our state. I caught that there are three main categories of focus. Number one, the beaches. Number two, retail. And of course, we've got to stay about 6 feet away from each other. The third I found rather interesting, jewelry stores. So for those of you who are still on lockdown and are eyeing a diamond or something of that sort, let me know, because I'm your gal. My guys reopen right down the street. We're living in wild times. We had a great conversation last week with some folks about the pros and cons of giving up civil liberties in order to reopen the economy and keep people healthy. We also heard from our friends in Pennsylvania who were focused on getting people safely back to work, and our friends in Georgia who have some really great ideas that they're implementing to get people off of unemployment without the government's help. So what I do know is that there are some good things happening to get people back to work safely. What I'm not sure of is how people are really feeling about what's going on out there. I'm a great example of someone who's flip-flopping all the time over this stuff. So today, that brings me to the topic of our show, where we will hear from our SPN messaging guru, Carrie Conco. We'll hear from our friend Aaron Norman with Heart and Mind Strategies, who's done some polling and is going to be able to give us some facts about how people are really feeling about coronavirus and about some key hot issues right now surrounding it. And we'll hear from our friend Ryan Green at the Illinois Policy Institute. Ryan's been putting this polling to use, getting stories out about real people and helping to drive public opinion on these issues. But first, of course, let's go to my favorite guest, who's always on our show, our fearless leader, Tracy Sharp. Tracy, welcome. How are you today?
I'm doing great, Rebecca. It's great to be here. And you mentioned the different states. As many of you know, I live in California, so no such luck on jewelry stores opening. Otherwise, I would have told my husband about that right away. But no doubt, many on this call have been watching how various states are managing the crisis. On the one hand, we here at SPN, we want states to flex their constitutional muscles and push back against overreach from that imperial city on the Potomac, DC, because we believe in the power of federalism, of decisions being made closer to home because they are more relevant and responsive to the needs of people in each state.
So Tracy, but how, how are you balancing that to lead this network? Because on one hand, I see the protesters and a part of me wants to join them. On the other hand, I'm seeing nurses with iPads FaceTiming their loved ones before they die, and then I just want to hole up in my house. So I am one of those people, again, who's all over the place. So how is SPN giving guidance to the network when every state is different on how to handle this?
Yeah, it's tricky. It calls for a balance, which is why the messaging research and polling info that we're going to hear from today's speakers is so important, because I know we feel strongly about getting Americans, society and communities reopened and going again and people back to work, but that's not how most of the country is feeling, which we'll dig into in a second. So it's challenging because we believe in federalism, but you're seeing so many progressive governors suddenly discovering the power of federalism to push back against an administration that for the most part, they don't agree with. So, and to exercise a degree of power over their citizens. So it's messy for sure, but over time, we think it will highlight another important value of federalism, and that is accountability. The American people will get a chance to see what works and what doesn't, to compare and contrast how different states are faring and the people of those states. And they'll get to decide how to hold their policymakers accountable. So the American people want more accountability for their policymakers because first and foremost, we're dealing with people's safety, with their lives and their livelihoods, while at the same time, we want to make sure that we adhere to the principles that make America exceptional, that make this republic so great. So that's why I think it's important that we get the data, that we get the polling, so we can really speak wisely and persuasively moving forward.
And as you said, every state is different. You tell me that all the time. And you've been telling me for years and years about the power of federalism, and we're seeing it in action, I think today more than in my lifetime, at least. In fact, I recently saw a poll that it was Rasmussen's latest poll saying that 64% of liberals are now saying that they believe in federalism, which is fascinating and such an opportunity for this network just to get out there and prove it and show that it works. So here we are, which of course brings us to the topic of today's conversation, some great polling that SPN has been involved in. There's a 10-week poll. We're just finished week 6, I believe. And to tell us more about that, I'm sorry, just finished the 5th week. To tell us more about the polling, we've got Carrie Conco, as I mentioned earlier, our messaging guru at SPN, and Aaron Norman with Heart and Mind Strategies. Guys, welcome to the show, and thanks for being here.
Thanks.
Now, Carrie, let's start with you. You know a lot about messaging. You're always giving me some strong education on it. But I see polls all the time. Why is SPN in the polling business? Why does this matter to our network?
Well, thanks, Rebecca, for giving me the opportunity to talk with you guys and letting me out of the house, even if it's virtually for just a little bit. And putting on real clothes. So that was nice too. My husband is very confused as to why I'm wearing hair and makeup right now. But in any case, the reason SPN is in the polling business is because values-based research, like we're going to talk about with Heart and Mind Strategies, is helping the network communicate effectively with audiences about complex issues. And it's something we've been doing well before this crisis hit. It's part of the reason I joined State Policy Network was because Tracy and I, the first time I met her, talked about the work they've been doing with Heart and Mind Strategies on values-based research. We've been right about our ideas for a really long time, but I think we've had a hard time making the case for freedom and free enterprise.
But Carrie, we've got our charts and our graphs and our statistics. How come nobody bought into that?
Well, it's because we need to understand people where they are, right? It's, you're trying to persuade, and if you don't make that connection for people, they're not going to make the same connections that we do. So this polling and this research that we do, especially with Heart and Mind, helps us to be more effective at communicating and persuading, both on the logical level, but where people make a lot of decisions in their hearts.
Oh, we're tapping into emotions. Okay. Well, that's why there's been such a big shift in our network over the last few years. So this poll in particular, Aaron, tell me, who exactly are you guys polling?
Sure. So we are doing a nationwide poll every week. We're actually launching Wave 6 today, but we talk to 1,000 Americans that are representative based on age, race and ethnicity, gender, and region of the country. So it gives us a good picture of the average American. And we're asking a series of questions. So we're asking a number of questions generally about the coronavirus, the impact it's had, how it's making people feel, how it's changing their lives. And also in the last couple of weeks, we've added some questions about when they think they'll get back to their normal life. What do they expect to do in the next couple of weeks? And we're tracking that over time to see when we hit an inflection point, when people get sort of tired of this, when they start maybe to, when they start to listen, when they stop listening, that sort of thing. And we're asking all of these general questions, and then we've opened it up to our clients and partners to add specific questions that are relevant to the work that they do. So we work with a wide variety of clients. We have travel and tourism organizations asking questions, and those are very different from the retail organizations that are asking questions, which are very different from the nonprofit groups like SPN. And we're able to take all of that together. Everybody's questions, individual questions, are proprietary, but we're able to bring that group together once a week and talk about what we learned, both from the individual questions everybody is asking and the people share as they feel comfortable with that, but also the questions that everybody has access to the data, and that data becomes publicly available. And Carrie, I don't know if you want to talk briefly about that experience of getting together with that group.
Yeah, I think the best part of my week basically is that Friday discussion with marketing people from all over the world who are trying to figure out how to communicate. Businesses trying to figure out how to communicate to their employees, and communicate to their customers. How do they maintain their brand? There's policy people who are trying to focus on, there's campaigns, right? Campaigns are trying to figure out how to campaign when you can't take a candidate out. These are all really interesting and challenging questions. And it's basically my weekly support group of people that are in this together trying to figure out how to communicate through challenging times.
So Carrie, as you enter into your weekly support group, you mentioned it's been 5 weeks. From week 1 to this week, how has that range of emotion changed in terms of the people you guys are polling, or has it changed?
Yeah, I mean, I think I would like Erin to talk a bit about it, but I think the things that have been most interesting to me is that we've seen sort of as confusion rises, people are getting angry. And that's been the biggest sort of shift in the past 5 weeks. Anger was not something people were registering early on, and we're starting to see that inch up a bit.
Is that anger at the economy being closed, or anger at the level of healthcare, or anger at everything?
Just general anger. I don't know about your household, but there tend to be fuses are a little shorter in the Conco home. But even when you go out shopping and stuff, we do see people saying that this is bringing people together, but I think there is an underlying frustration, and it's interesting to see that build over time. But Erin, maybe you talk a little bit about some of the major sentiments we're seeing in terms of negative feelings, but also some positive ones that are great.
Sure. So like Carrie said, we've seen anger trend up consistently over the 5 weeks. There are a number of other negative emotions that were focused on: concern, worry, and anxiety, or being scared or fearful. And those they all peaked in early April and have started to come back down to the levels they were at when we started this. So our first set of polling numbers come from March 19th. And we are now back on all of those negative emotions to where we started at. So we kind of went up a little bit and came back down, with the exception of anger. Anger has gone up and stayed up. Where now 1/4 of Americans say that this situation is making them feel angry. That's lower than the number who say they're concerned, which is 58%, or scared, which is 30%. But the interesting thing to me is the pattern that this is a concerning and worrying thing. And we saw a spike of that as you saw numbers increase, and now people are leveling off a bit on that. But the anger is hanging around. And that is something that we need to keep an eye on, and something I think that's going to have a big impact as you start to see protests, as you start to see states refusing to let up a bit in terms of the restrictions, or for states like Michigan that sort of went a little bit too far in people's eyes in the restrictions. That is going to continue to build.
Yeah, Erin, I think we jumped ahead too. We didn't really talk about sort of how people are viewing this as a threat. I just pulled this slide up, which is our coronavirus threat perception, and how that's corresponded with this as well.
Yeah, and you can see on the graph there, you can see that kind of spike in early April, where the number of people who thought that the coronavirus represented a real threat. And the way we ask that is we ask people to say, do you think of this as a real threat, or do you think it's overblown? Mm-hmm. So in early April, you had 83% of people saying it was a real threat. And now it's starting to tick back down in relation to the number of people who say that this is overblown, sort of ticking back up. That is something, that's a pattern I think that is going to continue and is going to be very regionally based. We've got some maps we can share later about how attitudes about the crisis in general are really starkly divided in terms of region, which speaks strongly to some of the things Tracy was saying earlier about this idea of a state by state look at what to do and how to handle this, because what's going on in Montana is very different than what's going on in New York. And the people on the ground in those states recognize and feel that.
Yeah, before we get into that, because that is fascinating stuff, let's back up for just a second, going back to the states. Carrie, how exactly are the states using this information within our network?
Well, we meet weekly with the communications directors and we walk through all of this research. We're also sharing it with the CEOs at the state think tanks. We've been incorporating it into our discussions about healthcare policy. We'll see some really cool information about how people are responding to the healthcare reforms that our groups have been driving in the states. But that's the main way. It really does inform how we go about connecting not just the policy prescription, but how it actually benefits society. So we're using this to sort of make those connections. And it's important right now to make those types of connections. People are in crisis. Our brains can only manage certain things. We're really focused on survival right now, whether we want to think about that or not. So it's important for our team in the state think tanks to be also making those connections for people. So to be explaining why there are benefits to opening up and increasing the supply of healthcare. Makes sense to people who think economically all the time, right? But not understanding, hey, this will get more people in the hospitals. This is going to lead to better health. This is going to give you peace of mind and security, which you really are craving right now.
Yeah, no, that makes sense. And the people who are leading these think tanks, they really are best positioned to respond to the unique needs of the people in their states. And so having this information so that they can understand it on this kind of level is amazing. So, okay, thanks for clearing that up.
Some of this stuff is really not intuitive to us. I think the most surprising thing I saw in the data was, I mean, Erin and I have been talking, we've probably been busier than ever the past 5 weeks, especially her. But, you know, one of the things that came up in the first survey was the fact that only about 1/3 of Americans can work from home. You know, when you're in the bubble and you're thinking policy and you're focused on that, it's really important to be reminded that there is this pressure out there. People are feeling, you know, we're, 2 to 3 pay periods into this, people are starting to feel the pressure of not being able to work.
And well, then what your polling probably doesn't show is that out of the 1/3 of people who are able to work from home, probably more than half of them aren't used to it, like my husband, and aren't very good at it, and make the other person who can work from home just a little bit crazy sometimes. But that's a story for a different day. Yes. All right, you mentioned political campaigns earlier. If you look, and Rob Lansing, thank you for submitting this question. That's a good one, so I want to ask it. Rob's question says, if you look at 5 or 6 of the key battleground states, what's your polling showing with regard to frustration in getting back to work? So Erin, you talked earlier about how every state is a little bit different. Can you walk us through some of those core states and what the sentiment is like there?
Sure. Carrie, can you throw up the map on, I think it's 5, that shows the data on protecting public health versus balancing the economy? Okay. So this is a question that we've been asking since the, I believe, wave 3. So when we got to early April, to that kind of peak of negative emotion, and we asked people, is it more important to protect public health at all costs, or is it more important to balance public health with the economy? And what we found, and this pattern has been consistent over the 3 weeks that we've asked this question, is that the degree to which people want to protect public health at all costs, and the question actually says sort of, and deal with the consequences later. So admitting that there will be consequences of only focusing on public health. But if you look at that, you've got more people than not saying that we still need to focus on public health. And you can see on the slide that Carrie just put up that we're actually trending downward on that the number of people who say, hey, it's really time to start balancing public health with economic concerns is ticking up. And so we looked at this by region, and that's the map. And we can see some pretty stark differences by region there. Can you advance down, Carrie? Thanks. So the red states are the ones that want to protect public health at all costs, and the darker the red, the stronger they feel about that. And the blue states are the ones with a higher margin of people saying we really need to balance that with the economy, and the darker, the stronger they feel about that. So you can see that it's really the mountain states out west that feel strongest about balancing the economy with public health concerns. And unsurprisingly, the states in the regions, and this was done regionally, by the way, we didn't have enough data to look state by state, but so all of these states are grouped into their census region. But the states that are hit hardest, those regions are the ones that say, no, we have to protect public health. So California, Washington, Oregon, that's the Pacific group. And then New England and Mid-Atlantic, which includes New York and New Jersey, are the ones that are saying, whoa, we've really got to make sure public health, that everybody's safe and healthy before we start thinking about the economy. And the states that are hit with this a little bit less feel differently. And so in reference to the question you started with, Rebecca, we also did a cut of this where we looked at 2 tiers of swing states in the presidential election.
Ooh, okay.
And found that being a swing state actually really didn't make a difference, that it ties back to the region. So Colorado, which is a swing state, is more in line with the rest of the mountain states than they are with the rest of the swing states. So that regional impact is really what's driving this attitude. That does have some implications for the campaign. If you know which swing states feel stronger about the balance, including the balance of the economy, you can do something with that information. But this is really driven more by where in the country folks are than kind of the political affiliation.
Okay. Wow, that's fascinating. Now, speaking of healthcare, on our first episode, we heard from some folks who were working with governors to quickly implement some really strong healthcare policy. In fact, I think we're up to more than 20 states now have taken policy ideas in terms of healthcare from this network and implemented them. The challenge, of course, is that many of them are for the short term. And Russ Walker, who's a senior policy analyst with SPN, made this great point to say, hey, we want this stuff to stay in the long term. And we're giving people a little taste of how great our policies are in hopes that they will want to keep them for the long term. Does your polling speak at all to Russ's hope that we can keep them forever? Or is there more work to be done there to convince the public?
So I'd start with one, the first thing that was really promising, and this is what we seized on going into the crisis. We had actually done a poll with Heart and Mind Strategies looking at the vital center. So the vital center being those people in key districts that we had seen sort of flip-flopping over the past elections.
Like from Obama to Trump kind of people? Okay.
Obama to Trump, yeah, exactly. And even in the midterms, right, we saw them go from Trump to Democrats. Think about Chester County, Pennsylvania has been slowly turning blue. So we had actually decided we were going to go into looking into the vital center. And one of the things that was really promising in that research in January was we saw that market-oriented healthcare reforms that we talk about that increase the supply, access, and quality to healthcare, again, solutions we've had for a really long time, appeal to people, right? So we saw strong support for health savings accounts. We saw changing up insurance alternatives, allowing portability of health insurance across states, and dealing with healthcare transparency, which are things you talked about on the first call. What we did is we went in to talk to governors and we said, look, here's what the data show, right? If you do this, it's not only necessary and important during this crisis to solve the problem of supply of healthcare, but it's highly favored by the American public. So that helps give them the political will to do the right thing. What's concerning is that we did test 2 questions, and Erin can always do a better job of this than me, but I want to talk. So
How about it?
Finally, I'm out. I can talk to people. So
this is what happens when Carrie puts makeup on and gets out of her housework clothes.
Getting out of my house. But if you look at the bottom blue line shows us that people said, look, when it comes to certificate of need laws, so getting rid of laws that require state permission in order for hospitals to have certain equipment or increase their bed capacity, 68% of Americans love that idea. We saw and you don't get that kind of support, right, Erin? That's like, when you get 60%, you can run with something, right?
Exactly.
Right.
Okay.
At least that's what I told our people. Anyway, so relaxing requirements to healthcare professionals to practice in any state, right? That's that great picture of doctors getting on airplanes and flying to New York. That doesn't happen without releasing those rules. Allowing pharmacists to practice, relaxing regulations to expand the practice of telemedicine. Again, all of these market reforms we've been talking about for a really long time are now politically possible. The Overton window open. What's challenging is the set of bars on top. We asked also, okay, if the government said this is great, how do you feel they should manage that after? The red line shows people thinking they should reverse it right after the crisis is over. The gray line says we need more data. That's the second longest line in all of those. And the third is whether or not the change should be made permanent. That's the green line, right? And those are about a quarter of Americans thinking, yeah, these are great reforms and we should keep them. But you still have about half of America saying, I need more data. And you asked earlier, Painter, about how we're using this. We're talking to our groups and saying, look, you got these reforms, you got to hold the center on this. You've got to make these reforms permanent. The way you make them permanent is you share the data showing support, and you demonstrate that these successes are working in the state. So we're encouraging them to gather stories, gather data, and share that with policymakers so that we can hold these healthcare reforms.
Wow, that's fascinating. Thank you.
Yep.
Okay, I'm shifting gears from what was sort of good news to a little bit of doom and gloom. I talked to my friends and I was surprised to hear, they live all over the country. We did a Zoom call and I was surprised to hear their thoughts on where they're getting their information and who they trust. And it got me thinking, I wonder who the American people trust right now. I don't really have high trust in large parts of the government myself. So what's the data telling you on trust?
So the data is telling us that there isn't actually a lot of trust out there in general.
Okay.
Of all of the different organizations that we tested in this question about how much do you trust various organizations or levels of government, the CDC is the most trusted, and that's actually declined 7 points since we started. So now just over half of the American people trust the CDC, which is pretty close to the number that we have that trust their local health departments, which is 51%. So again, just over half of Americans. If you want to go to the next slide, Carrie, those are the most trusted organizations, the CDC and local health organizations, but still not a lot of trust. When you look at a variety of other public and private entities, state governments are actually the most trusted in this situation, which I think is great news for the network and federalism, especially when you contrast it with the federal government. 43% last week said that they trust state governments. Only 30% say that they trust the federal government. And President Trump actually does a little bit better than the federal government, surprisingly. Small business is also kind of in that higher tier, but again, these are low numbers. 35% saying they trust small business, and that's down just a smidge since we started tracking it. But at the end of the day, I think what we're seeing is that people are really skeptical of a lot of what's out there, regardless of where it's coming from, but that the state governments have an opportunity and the attention of people in a way that they don't normally have. And I think something key to point out here is how that line trends on state and local government. If you look at where we started in mid-March and where we are now, state government has gone up 4 points, local governments kind of bounced around. So the state governments are in a place where they're actually proving themselves to the people that they can take on a level of leadership and responsibility that has in recent times been assumed as a federal position. So that's encouraging, even if the overall level of trust is what we would consider low.
Yeah, that is. By the way, I'm not sure if you guys can hear a wailing baby in the background, but if so, we're not torturing small children here. It's just someone's getting a diaper change and not happy about it. So I apologize.
Hey, Rebecca, did you see there's a question about California? And I didn't know if Aaron, I have a couple anecdotal thoughts on it, but I didn't know if Aaron and Carrie wanted to take on the question in the queue about California.
Oh, thanks, Tracy. I didn't see that.
I can do an overview, but I think the stories really end up highlighting a lot of what's going on. So we looked at it regionally. So where California is sort of deep red in that map, and which means it had a focus on public health above other concerns. That data is connected to Washington and Oregon, and Washington obviously has kind of a different situation than a lot of the other states in the nation. My gut would be that a lot of that is being driven by the large cities in California, and that if we had the ability to look at LA, San Francisco, separate from sort of the more rural parts of California, that we would get a different feel for it. But that's, Tracy, I don't know if you want to jump in and just share what you're hearing on the ground.
Yeah, every day the local press runs the numbers county by county in California. And you're right, LA County, the 5 Bay Area counties, especially Santa Clara, have hundreds of cases. Whereas the rural eastern part of California, those counties, 1, 2, my Sentinel is going, but so I do think it's an abnormality in that way.
All right. So Aaron and Carrie, over the last 5 weeks, has there been anything we haven't already covered that you found to be either shocking or hugely informative for the network during this time?
You
want to go first?
Yeah, I mean, I'll go first. I mentioned it earlier. I think the most shocking thing was week 1 when we saw that 57% of Americans can't work at home at all. That 27% say they can work and 16% maybe work from home. And I've tried to remind my own team and talk to a lot of friends who are trying this work at home thing that SPN's been doing for a long time. I said, look, you're at home during a crisis and you're trying to work. You're going to have crying babies getting diapers changed, dogs yelling, other distractions, husbands with really loud conference calls. You're trying to teach your kid algebra, and you're managing all of the crazy that's going on. So I think the stress is really real. And I think we talked about that early on in the study, that at first the pandemic felt really distant to people. But now the effects are starting to be felt. If people aren't necessarily getting sick, but they're definitely feeling the effects of pandemic. We looked at the employment effects on Americans in the past month. 21% said they had their hours and shifts reduced. This is hurting people economically. And, the thing I worry about most is the productivity of the country, right? So how fast can we get back? And that's, I think, part of the interesting conversation is we've got to look at how people are feeling and how they're processing this information in order to make those good decisions, because we can open up, but there's a chance that even if you do open up, people aren't going to want to go. And that's something we're also seeing in the data, right?
Well, yeah, that's interesting. I saw, again, my friend lives in Georgia and they're even opening up their gyms, and I can't wait to see if people are actually lining up to get inside. You talk about a poll, someone should be there with a clicker, just seeing the difference between this week and 3 months ago.
Right. I watched the Reddit conversation yesterday when the president announced wanting to open up the federal government. And what I saw were just people saying, I can't go. I've got, either a child who can't go to school, or I have somebody in my household who is immune compromised, or I'm immune compromised. So even with the opening, it's going to be very nuanced.
Yeah,
Yeah.
Thanks, Carrie. Erin, any final thoughts from you before we hear from Ryan?
One thing that stood out to me, we asked a question for the first time last week about whether people believed that the decision to reopen the economy should be one broad decision that comes from the federal government, or if it should be done on a state-by-state basis. Over half of people favor a state-by-state basis, which I didn't find that surprising, but it was encouraging. The bit that was really interesting is that Democrats are more likely to favor a state-by-state approach, and Republicans are more likely than the average. It's still a minority, but they're more likely than the average to prefer a federal approach. And so we can tie this to the Trump effect with other data that we have in the survey, but I find it really amusing and also, again, encouraging that you're having this federalism moment that is not coming from right of center. And I think there's so much to do with that and so much that can be done with that, both now and then just as an example moving forward when we talk about the benefits of federalism in any context, that you can nudge people that might be untraditional allies by saying, hey, remember COVID? So that's something we asked for the first time last week in Wave 5. I'm really interested to see how that progresses as some of the states decide to reopen and make those moves. But that was one thing this week that really stood out to me.
Yeah, thank you. I mean, no doubt, this is the perfect storm for everything this network has existed to do for all of these years. I mean, you've got people trusting state governments, you've got Democrats talking about federalism, you've got allies and unlikely bedfellows all over the place. You've got, again, Governor Cuomo talking about the states creating the federal government, not the other way around, and whether that was a talking point or not, it's just good that it's out there now because we can take advantage of that. And while this is a terrible situation for a lot of people in a lot of states, I'm so grateful to the viewers who are dialed in and who've been with us for so many years, because this network is strong and activated and using this information to safely get people back to work and keep them healthy. So I just wanted to pause for a second and thank you guys for putting us in this position to be ready, because we are. Which brings me to our next guest. And thank you, Carrie and Erin. Appreciated all that great information. Ryan Green. Okay, speaking of the network being ready, is Ryan with us?
I am.
Okay, there you are, Ryan. Now, Ryan comes to us with a background from the set of Seinfeld. For those of you who are looking at that room thinking, that looks oddly familiar. Ryan, we're so glad you're here. Tracy's been talking quite a bit on the last couple of shows about people over politics, and that seems to be almost a guiding compass for the network during this time. And there's been no group better, I think, than Illinois Policy Institute and your allied organizations who have gone out and made this about people. You know, I look at the news, we're inundated with COVID all the time. And I saw last week that Illinois Policy Institute had op-eds, 2 different op-eds in 2 of the biggest papers in Chicago, because you guys are telling real stories. You have gotten rid of your charts and well, maybe you haven't gotten rid of them. I'm sure you guys are still excited about them and drooling all over them and whatnot, but you've turned them into emotional, compelling stories. And I just can't thank you enough for being here with us today to share what you guys are doing. And also, it has to be noted, you're not doing this in a vacuum. You are working with Carrie Conco and others within this network and making sure that other think tanks understand how to do this. So thanks for being with us. We're excited to have you.
Thanks, glad to be here. Yeah, so we actually interact with about 250,000 unique individuals per day through our various channels. So it's difficult for us not to tell the stories that we hear coming in on a daily basis. When the COVID crisis hit, people immediately turned to us and they were looking for answers to a lot of the questions that they couldn't get answered through government resources. So one of the first stories we heard was from an Irish pub owner in Chicago. Mm-hmm. And the COVID crisis sort of started to escalate during St. Patty's Day, which is a major holiday in Chicago. So she had to close her restaurant down that's been in business for 20 years. And her son actually took his first steps in the restaurant. So it's more than just a place that she goes to earn a living. I mean, it's part of her DNA. So she reached out to us and we interviewed her via Zoom. And one of the first things that she said that she was concerned about was that if she'd survived this, which she had survived the 2008 crisis and a few other recessions, is that she was worried the progressive income tax would hit her business in 2021. The progressive income tax is currently on the ballot in Illinois and will be voted on in November. And a lot of business owners are concerned that if they're able to survive this, stand back up and start earning money, it'll all be stripped away as part of the progressive income tax in 2021. So we featured her story in the Chicago Tribune. And then we also had another article in the Chicago Sun-Times as well, talking about the dangers of the progressive tax at this time.
And how did people in the state of Illinois respond to that story?
The governor was actually asked during a press conference, and he doubled down and said the state needs the progressive tax revenue now more than ever. You may have seen recently, we worked with the New York Times to break a story about Illinois asking for a pension bailout. You know, when a recession like this hits, you quickly learn where the bodies are buried, and there are a lot of bodies buried in Illinois, unfortunately, pensions being a major issue.
Yeah, well, you definitely are up against a big fight in Illinois. So tell me a little bit more about what you're learning from citizens, taxpayers who are on the ground and suffering right now. What other stories have you guys gotten out there?
Yeah, so
what difference is it making in their lives? Has there been some traction around it yet?
Yeah, and one of the other stories we heard was from another small business owner, speaking of the pension issue and crowding out services, is he actually joined the Army after 9/11, served a tour, was injured because he was thrown from a Humvee, came home, decided he wanted to do something that he said made him happy, and painting made him happy, so he started a painting company. He was also raised by a single mother, so he wanted to focus on employing women. So his company, he and his wife employ almost all women at their painting company. When the crisis hit, social distancing, they can no longer paint homes. So he had to lay everyone off, and he quickly heard from employees that they had filed unemployment but weren't receiving benefits. And one of the issues in Illinois is that the unemployment system is running out of cash. So he fronted money to his employees and essentially covered, a full month's salary, hoping that the unemployment system would catch up. We worked with him and placed his op-ed in the 5th largest paper in the state of Illinois to draw attention to the unemployment system. And now that's being discussed at all of the press conferences with the governor as well.
Oh, that's great. You guys are really driving some of this policy to change the lives of folks. What do you feel like you've learned from talking with these business owners over the course of the last few weeks?
I think the biggest thing that we've heard from them is consistently is a lot of disappointment. They've invested their entire lives in building a small business, and they paid their taxes, they paid their unemployment insurance, they've paid into all these systems, and then when they need these systems that they've been paying into, unemployment is literally an insurance, they paid into it and it's not there because the state has mismanaged its funds to the point where it has to borrow from these systems to pay other debts. And I think it's a lot of disappointment, a lot of frustration, and fear at this point. There's a lot of fear coming from these individuals because they've survived. Every business we've talked to has survived a major economic downturn, and this one, they don't know if they're going to be able to survive.
Wow. And how has the polling that Aaron and Carrie were talking about earlier changed or influenced the way you guys are approaching this crisis?
The biggest insight from the polling that we saw that is very much apparent is the balance between safety and saving the economy. Illinoisans have done a great job. There's actually a map out where you can show how your area is scoring in terms of social distancing, and Illinois has done extremely well. We've all come together. We've taken everything seriously. But I think now, we want to make sure that the small business owners are being heard. One of the other businesses we talked to actually survived the Great Depression, World War II, and the Great Recession. And they were concerned. It's a candy shop, Anderson's Candy Shop in Illinois. and their prime time is Easter, so they weren't able to run during Easter. They saw a 60% hit in sales. They reached out to us, we featured them, and they were able to generate enough sales to pay 2 months of operating costs because so many people reached out from our audience. So that was another great story. But
what's the name of their business, in case any of our viewers want to order anything?
Anderson's Candy Shop.
Anderson's Candy Shop.
Yeah.
I like candy, so I. Thanks.
We do too. Yes. Yeah. So yeah, I think that the conversation has definitely shifted in Illinois now towards what is the plan for reopening. It looks like we're going to be extended to June. So, people want to know, are there going to be benefits for the unemployed folks that haven't been able to receive those? What happens with gig workers, independent contractors? So we're going to make sure that all of those people continue to be heard.
Yeah. Well, and Ryan, I can't stress enough how awesome it is what you guys have done for folks in Illinois. And again, you are a known leader throughout this network in terms of your storytelling ability and the way that you take very dry, intellectual, wonky things and turn them into compelling stories like the ones you just shared. So can you tell us how you are taking what you're doing now and sharing it with your peers in other states? Because while every state is different, I'm pretty certain that every state has stories like these and can do a better job of getting them out there.
Yeah, one of the things that we've had to adapt to, obviously, is changing how we tell these stories, doing them virtually through Zoom, and having people submit creative assets, so photography or video or whatever they have. So we've put together a manual on how to execute storytelling in the time of COVID. One of the things that we actually love to do is go out and meet these people, shake their hands, buy their candy, or eat in their restaurants, because this is our community. These are the folks that we interact with daily. So this has been a bit of a change for us, but we're putting together sort of an operating manual and a strategy for being able to scale up storytelling during this time.
Oh, that's fantastic. And that skill can be used forever.
Right. I mean, Ryan's such an integral part of our peer network and with the great communicators, right? And what's been great about Ryan, in addition to the fact that I can never keep up with him in a bar, is that he also has an amazing ability to break big strategy down into actionable slices, so that no matter what size the organization is, they're able to engage on these strategies, tell great stories, and also build their audiences as they go. And he's been a vital part of the network being able to do that better year over year.
Yeah.
I would add too, Rebecca, that these stories that Ryan's giving us, it's a great example of how this network is putting people over politics, right? I mean, government may try to monopolize power at both the federal and state level, but they don't have a monopoly on knowledge or relevance at the state and local level, for sure, which is why this work matters. Proximity matters. Ryan, this is good stuff.
Yeah, it's great.
Yeah, thank you. I can't thank you all enough for being here, Ryan. Those are great stories. I love the work you guys are doing. I love how it's spreading all across the nation. Aaron, I'm assuming you've never polled during a pandemic, so we were glad to get the firsthand account of what you guys are seeing. And Carrie and Tracy, it's always great talking with you. I think, again, Tracy summed it up best. It's people over politics. And for the first time, this network understands the people we are trying to help on very deep levels so that we can speak their language and help them the best we can. So I just want to thank you guys again for tuning in today. And hope you will join us next week, where we dig into education in light of the coronavirus, which should be quite a show because there's a lot of there, as they say. So thank you guys for making all this possible. Thanks for tuning in. And if we didn't get to a question today, we'll certainly give you guys a call and answer them after the show. Thanks again.
Thank
you.
Thanks, everyone.